No, but don't change the color bars yet. No. Okay. Good afternoon, everybody. Just a few minutes for last minute stragglers.
View as some choppiness. But don't change the color bars yet.
Hey, I need Jorge and Doctor on the phone. Okay.
Yeah, because I would rather just choose one. Otherwise, I guess right now.
Good afternoon, everybody. Thank you for joining us all. We're going to be starting here in a few minutes. Joining us this afternoon is going to be Mayor DiMargo and also Dr. Hector Ocaranza. And we're just waiting for a few more folks to come into this press conference real quick. Okay, folks, we're going to go ahead and start the press conference. And I'd like to invite Mayor, if you could start us off.
Thank you, everyone, for joining us. I want to give you an update. Dr. Ocaranza will give you the latest numbers, but because everybody is waiting anxiously to hear, we're up to 125, as I understand it. All essential businesses that remain open must, when possible, comply with social distancing requirements, including lines formed at the business and in the parking lot. And all essential businesses are required to conduct regular health checks of their employees. This is something new that we added last week. And those checks can be either temperature checks or respiratory screenings. The simplest is the temperature check. If they're above 99 degrees, they shouldn't be at work. You must space your workers and your customers at least 6 feet apart. You've got to stagger your employee work schedules. You've got to sanitize commonly used touched surfaces. You've got to provide facilities for hand washing or hand sanitizer. Any employee who has traveled to a place that has a high incidence of COVID-19 cases, as identified by both the state and federal mandates, must not be permitted to return to work until after a self-quarantine of 14 days. You could spread COVID-19 to others even if you don't feel sick. The Centers for Disease Control, the CDC, has recommended, first, everyone should wear a cloth face cover when they have to go out in public, for example, to the grocery store or to pick up any other necessities. Cloth face coverings should not be placed on young children under the age of 2 or on anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are infected and asymptomatic. Do not use a face mask meant for a healthcare worker. The cloth face coverings recommended are not the surgical masks or the N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. The wearing of face masks in public is not a mandate. I repeat, the wearing of face masks in public is not a mandate. It is a recommendation. It will help reduce the spread of the virus by those who do not know that they are sick. The number of cases in El Paso continues to increase daily. Dr. Ocaranza will give you the update on that. And I would like to stress to the public, compliance to the stay-home order is critical to the public health of this community and safety of this community. While all parks and playgrounds are closed, you can still walk and bike around your neighborhood, but maintain a distance of at least 6 feet. Thank you to all who have complied with the order. You are making a difference in how we suppress the spread of this virus. I would also like to thank all those essential workers who continue to show up to work every day to make sure we are able to buy our groceries and pick up our food from our favorite restaurants. Thank you to our first responders who continue to keep us safe during this time of uncertainty. And I would especially like to thank all of our healthcare workers who are caring for those who have been hospitalized. To all the doctors and nurses working daily on the front lines of this pandemic, we are truly grateful. Thank you. And now I'll turn it over to Dr. Ocaranza.
Dr. Ocaranza, you need to unmute yourself, please.
Can you hear me now?
Yes, sir. Thank you.
Okay. Excellent. Today we have 125 cases, of which 59 are male and 66 female. we need to stress the people that the numbers are going to continue to go up and to follow the orders that we have updated. As Mayor Margot said, we are recommending that people that are out in the street and out and doing essential things out of the house to wear the cloth mask. And that is important because if we all wear the cloth mask, we're going to be protecting each other and we will be able to slow down the spread of the disease. We want to continue stress the importance of staying home and not going in groups or taking the whole household to go perform those essential things like going out to buy groceries. Please, everybody in the public, it is advised to stay home and only choose one person to go and perform those essential tasks. We also want to remind the people or let them know that more than half of the cases that we have are in young adults. And those young adults, even though they might get a mild disease, they can make others a lot sicker, especially the ones that are mostly vulnerable. So it is a reminder that young adults are getting the infection, but can make the other members of the household that are mostly vulnerable sicker. So please, it is very important to do that. Remember to maintain the social distancing when you're outside, and also that all gatherings of any size are prohibited in the city and the county. The 100-mile rule that we put in the order also is for all those that are getting anybody from outside of our community into the city. They need to stay in self-quarantine for at least 14 days. Please remember that. And if there's somebody that is transient in our community, like truck drivers, they can come in but stay at home, and whenever they need to leave, they can go out and take their routes again. So again, those rules and orders, please, we do need to take responsibility and do our parts and follow those orders. Thank you.
Doctor Sid, ¿nos puede dar su traducción, por favor?
Claro que sí. Ahora en español tenemos 125 casos y de los cuales la gran mayoría, más de la mitad de estos casos es en adultos jóvenes. Estos adultos jóvenes, aunque no tienen la enfermedad severa, pueden transmitir el virus a otros más vulnerables en nuestra comunidad y en nuestro hogar, que son los adultos mayores y aquellos que pueden tener complicaciones mucho más severas. Entonces les recordamos y les pedimos que estos adultos jóvenes tomen estas órdenes que hemos actualizado, que las tomen muy en serio, porque son los que posiblemente van a causar que se pueda esparcir el virus mucho más rápido y tener un problema mucho más grande. Les estamos recomendando a la población en general que cuando estén fuera puedan usar un cubrebocas de lo más sencillo que tengan, que sea de tela. Por favor, no usen cubrebocas que se usan en el hospital, porque ese tipo de equipo de protección personal lo necesitamos en los hospitales para todo aquel personal de salud que está cuidando de nuestros enfermos. Le pedimos a la población en general que si va a salir a hacer alguna de las actividades esenciales, lo haga cubriéndose la boca con cualquier cubrebocas, ya sea que lo hayan prefabricado en su casa o que consigan que sea de tela. Es bien importante que sigan todas las órdenes y todas las reglas, porque de esta manera nos vamos a conservar sanos y vamos a cuidarnos unos a otros para que el virus no tenga un efecto negativo en nuestra comunidad. Les agradecemos su cooperación y seguiremos informándoles acerca del estado de nuestra comunidad y de cómo se ha ido afectando con el virus.
Gracias, doctor. Now we're going to open up to the questions that we've received from the media. The first question that we have, do we have a rough estimate of how many people have been tested in El Paso, whether by the public or private lab? The state of Texas has been providing statewide numbers for both public and private labs for some time, but El Paso has only reported the number of tests by the public lab. And joining us is Assistant Chief Jorge Rodriguez.
Good afternoon. So at this point, what we've been reporting is the Department of Public Health lab tests that have been done here locally in El Paso. We are, through our drive-through, working with another private company and also through a federal contract. Those total numbers we've done well over 100 specimen collections. So those have gone out to test. So when you combine our local tests and those that have been collected at the drive-through, approximately well over 1,500.
Thank you. Doctor, si nos puede dar la traducción, por favor.
De la cantidad de pruebas que se han hecho por parte de laboratorios privados y el Departamento de Salud, tenemos por el drive-thru que uno de los laboratorios privados está haciendo una parte de esas pruebas. También un contrato que tenemos con el gobierno federal hace otra cantidad de pruebas, y en el Departamento de Salud hacemos otras pruebas. Hemos hecho en total alrededor de más de 1,500 pruebas por todo este sistema que tenemos de drive-thru, y son los números que podemos reportar hasta este momento.
Gracias, doctor. The next question, will we see additional police or COVID compliance at public events, at the parks, or at any of the locations where people are gathering for the Easter holiday period? And I'm going to ask Mayor if you might be able to speak to this.
Our public parks are closed. We've closed them, the county's closed them. There's no gathering there, so there should not be during Easter. I understand that the Chamizal is also asking that they be closed because of the typical Easter turnout. It's a shame we can't do that, but we're right on the cusp of maybe suppressing this based on what experts say. It takes 2 to 2.5 weeks from the time you institute your strongest closure and effort related to social distancing. Code compliance has been out there. Jorge wants to add anything to that. They are made, I understand, as of yesterday or day before, something like well over 300 visits, and they are continuing to go out and enforce and inform. Jorge, do you want to add anything to that?
So code compliance, they continue to monitor all public spaces to ensure that they're not occurring, and they're following according to the new tighter regulations that came out of the order from last week. So that work is ongoing.
Doctor, si nos puede dar la traducción, por favor. Se lo agradecemos. La pregunta fue, ¿habrá patrullas adicionales para impedir cualquier reunión pública en los parques o sitios donde se congrúa gente durante este domingo de Pascua?
Por esa misma razón, hemos cerrado todos los parques y todos los lugares públicos en los que la gente se juntaba, con el fin de evitar estas aglomeraciones de gente. Les pedimos de favor que no lo hagan, sobre todo en este domingo de Pascua que viene, que la gente acostumbraba a juntarse y salir a los parques. Entonces, les pedimos que no lo hagan, que se queden en su casa y que no vayan a tratar de usar ninguno de los parques que ya hemos ordenado que se cierren. Hemos mandado a personal del Departamento de Bomberos que se encargan de inspeccionar lugares, y se han visitado más de 300 lugares en los cuales se les ha educado y se les ha dado un fuerte aviso y llamado de atención cuando no cumplen con las reglas y las órdenes que se les han dado.
Gracias, doctor. The next question is building on that, the last question. Have there been additional violations or citations or any arrests as it relates to COVID violations?
I'll let Jorge respond to that. I haven't heard about any.
No, we haven't got any reports of additional citations or arrests over the weekend. We will again continue to monitor. The compliance task force continues to survey all of El Paso, ensuring that those public gatherings and large groups are not occurring.
By the way, if someone sees large groups gathering and not maintaining their social distance, they can call 311 and report that.
That's correct.
Thank you, gentlemen. If I could ask Dr. Ocaranza to help translate.
Hasta el momento no ha habido ningún arresto en cuanto a que hayan infringido las reglas y las órdenes que damos con relación al COVID-19, pero si ven a gente que está haciendo fiestas, alguna otra violación a estas reglas, por favor marque el 311. Vamos a seguir enforzando todas las reglas y personal que tenemos de inspección va a seguir visitando negocios y otras partes en donde se esté violando las órdenes.
Gracias, doctor. The next question may be for Jorge. Has El Paso had any confirmed COVID tests in assisted living facilities or other long-term care facilities? I'm not sure if we have that response.
Laura, you're correct. I don't have that information offhand. We can check with our epidemiology program to assess that.
Okay. The next question is El Paso and Juarez collaborate on a variety of public health issues. How is the city and the county coordinating with health authorities in Ciudad Juarez, which has just confirmed 2 COVID-19 deaths?
We have constant communication with health authorities in Ciudad Juarez, and the way they institute rules in Mexico and Ciudad Juarez is a little bit different than here in El Paso, but we're hoping that stricter rules are instituted in Mexico so we all can have similar orders in place. Estamos en continua comunicación con autoridades de salubridad en México y esperamos que en algún momento las reglas sanitarias que instituyen en México puedan ser un poco similares a las que hemos instituido en El Paso, aunque esas reglas sanitarias se instituyen y vienen desde la Ciudad de México, la ciudad de Chihuahua, y es un poco diferente a cómo se instituyen en nuestra ciudad.
Gracias, doctor. The next question. What does El Paso plan to do if and or when the PPE runs out?
So we're not anticipating a shortage of personal protective equipment. We are working closely with the Texas Department of Emergency Management, Department of State Health Services, and also FEMA. They do have large contracts with manufacturers that are producing these, and they're being prioritized for healthcare workers, first responders. So anyone that's independently making those purchases are being prioritized for government and for those critical infrastructure areas. So that's an ongoing. Texas has created a task force for personal protective equipment supply chain, and we're in close coordination with them to make sure that we have the communities in place to respond as this response continues over the next several weeks.
Thank you, sir. If I could ask Dr. Ocaranza to please help translate.
En estos momentos no esperamos que nos hagan falta equipo de protección personal y tenemos comunicación muy directa con el Estado por medio del Departamento de Salud del Estado de Texas, de la Oficina de Manejo de Emergencias del Estado, los cuales tienen contrato también con el gobierno federal para que nos suministren más equipo de protección personal y que no nos haga falta en la ciudad.
Thank you, gentlemen. The next question. ¿Cuáles van a ser los controles o recomendaciones para restringir aún más el flujo hacia Juárez? Doctor.
Bueno, hasta el momento les hemos pedido la colaboración de la población para que limiten ese tránsito de personas dentro de nuestra ciudad y fuera de nuestra ciudad. Seguiremos pidiendo y de una manera muy insistente a toda la comunidad que no haga ese tipo de viajes si no necesita hacerlo. Todavía no vamos a poner otro tipo de medidas que restrinjan el movimiento de personas dentro de la ciudad o hacia afuera de la ciudad. Pero si en algún momento necesitáramos hacerlo, lo haríamos.
En inglés, por favor.
At this moment, we don't have any plans of restricting movement of people from and into the city or to another city. In this example was Ciudad Juárez, and we've been urging the community to refrain from doing those non-essential trips so they can stay home. In this way, we can promote the social distancing, staying home. But if in the near future we will need to restrict mobility of the people within the city or non-essential trips to other places, we will consider those options.
Gracias, doctor. The next question, how many test kits does El Paso currently have in supply? Where does that supply come from? And Jorge, I'm not sure if you can provide a response.
Sure. So the ones that the test kits that are being utilized at the Department of Public Health lab, those are through the CDC, through the Department of State Health Services, and those are our last order was close to 1,000, and we already have another order in place for more.
Doctor, si nos puede dar la traducción.
En este momento, las pruebas que tenemos disponibles a través del Departamento de Salud se nos han prohibido por parte del CDC y por el Estado. La última orden que pusimos fue de aproximadamente 1,000 pruebas y estamos esperando respuesta por más pruebas.
Gracias, doctor. The next question, what is our area's hospital capacity? And what is the extra capacity added by the treatment areas outside of Providence and UMC?
So we have close to 2,200 licensed beds here in the El Paso area. Within the hospitals, they have surge plans to increase their capacities within their own walls. And then the planning that we're conducting for alternative care sites to help augment the space within the hospitals is ongoing. But we do have a bed count of 2,200 licensed beds within the El Paso region.
Tenemos aproximadamente 2,200 cámaras registradas en todos los hospitales en El Paso y tenemos en plan otro número de camas aleatorias que se pueden disponer si acaso surge la necesidad de hacerlo.
Gracias, doctor. The next question. How big of a team does the city have doing the contact tracing? How many contacts or contact tracing? How many contacts are being traced? I believe this has to do with the epidemiology team in terms of how many are staffed in the epidemiology. I don't know if you all have that number offhand.
We don't have the exact number in hand, but what we know is that our epidemiology team has been expanded drastically based on our needs, and we have included many nurses and other healthcare professionals that has been able to expand our epidemiological investigation capacity. We will have a capacity to expand even further our epidemiology team as the need arises.
En español, por favor, doctor.
Y en español, tenemos a todo nuestro equipo de epidemiología, el cual ya se ha incrementado en número debido a la necesidad que hemos tenido, y tenemos todavía más capacidad de aumentar nuestra fuerza laboral de acuerdo a las necesidades que se van teniendo en la ciudad para ayudar a las investigaciones epidemiológicas por parte del Departamento de Salud.
The next question. There are 4 CBP officers who tested positive for COVID-19. Are those included in the county's count?
I believe we are including those into the positive count since they are residents of El Paso. If they were not residents of El Paso, then we would not count them, but they're counted as residents and not as places of work. Y en español, hay 4 oficiales de la agencia de aduanas que resultaron positivos, y esos los hemos contado en todos los positivos debido a que residen en nuestra ciudad. Y si no residieran en nuestra ciudad, no los contaríamos como positivos. Y estos casos positivos los contamos de acuerdo a su lugar de residencia y no a su lugar de trabajo.
The next question. Is the city or the county involved in the efforts to keep CBP or Border Patrol safe? And I believe that the federal government is responsible for that. Jorge, can you confirm or correct?
Yes, ma'am. With CBP and our federal partners, we don't really have an ability to influence their policies, but we do work closely with them in regard to individuals that within their workforce, if they are exposed, we work closely to provide them whatever guidance we can provide.
Thank you, Jorge. And I believe, Dr. O, if you could provide the translation.
Con aquellos agentes de la agencia de aduanas y de la patrulla fronteriza, nosotros en la ciudad no tenemos jurisdicción de qué es lo que necesitan hacer mientras que están en la línea de trabajo, pero sí estamos en comunicación directa con ellos, y esas agencias son responsables directamente del gobierno federal, y el CDC es el que se encarga de establecer esos protocolos.
Gracias, doctor. The next question. Has anyone in El Paso died from the coronavirus?
Not at this moment, and hopefully we don't have any deaths, but that's why we urge the community to be vigilant and to do their part and staying home so we can prevent that from happening as well. Y hasta el momento no tenemos ninguna defunción relacionada al COVID-19, pero no por eso queremos dejar de redoblar nuestros esfuerzos para poder prevenir este tipo de tragedias y no queremos que tengamos ninguna defunción de acuerdo al COVID-19 y esperamos no tenerlas, pero esta es responsabilidad de todos el poder mantener a la ciudad segura y sana.
Gracias, doctor. Can either of you speak, or can any of you speak to how many of the cases are relatives in order to explain how easily the virus is transmitted?
So explain how the cases can be related or relative?
Relatives. The relatives amongst those who have positive cases is the question.
Well, when we do the investigations, if we have one positive case, there is always that possibility that within their household, there's going to be some other ones that are going to become sick. And we have seen that it has been true for some of the cases that we've had, that people within the same household gets infected. Another thing that we tell the community that there's even people that can be having no symptoms and transmit the disease. And that's what we're recommending the people when they're outside, they can wear their cloth masks. And that's a way that we're gonna protect each other from spreading the virus in that way. It is very, very important that people understand that you can transmit virus or somebody else can transmit the virus while being outside. So, and that's the way that we see the numbers growing very rapidly because of the close contact and the possibility of infecting others is greater. Y en español, el virus se puede transmitir muy fácilmente cuando estamos en un contacto cercano y por eso muchos de estos casos positivos se pueden infectar a sus seres queridos que viven con ellos. De esa manera también hay otras personas que no tienen síntomas, que pueden transmitir el virus de una manera muy fácil al estar en contacto cercano con otras gentes, sobre todo cuando andan en la calle. Es por eso que les recomendamos a la población que pueden usar máscaras que sean de tela, que puedan hacer en su casa cuando vayan a estar fuera haciendo o realizando estos viajes esenciales, cuando vayan al mandado, cuando vayan a otros lugares y de esta manera prevenir el contagio de unas personas a otras. Si nos protegemos unos a otros, podremos disminuir la posibilidad de que se contagien cualquiera de nuestros seres queridos.
Gracias, doctor. What indications suggest that social distancing and the stay-at-home work safe order are working? And Mayor, I don't know if you might be able to speak to this one.
Well, I think quite candidly, the fact that we haven't had any deaths thus far, and we hope and pray we don't, but by virtue of the number of people we have in ICU, I understand from a public health expert this morning out of New York or out of Washington, said typically 67% pass away out of ICU when they're in ICU. We haven't had that yet. People need to understand this is serious. And maybe, well, I don't even go there, but the bottom line is that, as Dr. Ocaranza said, social distancing is the critical key to this and to suppressing this virus. We are approximately, based on the experts and the modeling, about 2.5 weeks away from the peak, based on what we did last Wednesday, according to all the experts. So if we can get through this, and we can get through this, and we hope and pray with no deaths, then we're going to be totally unique and atypical, because there's not a community in Texas of any size that I know that hasn't experienced death from coronavirus. So people need to understand this is not something that we can just toss about lightly. It is a life or death situation. We talked about lives versus livelihoods when we started doing this, and that is absolutely critical. Dr. O, I don't know if you want to add anything to that.
Yes, sir. This is exactly what we've been telling the people, that we're a few weeks away from having our peak, and the fact that we haven't any deaths is good, but it shouldn't be reassuring for people. And this is the time, the most critical time, where we need to observe the social distancing. We need to follow the orders and follow the rules, because we cannot afford to lose any lives here in El Paso. That is the bottom line, and I want to mention that after you, because people need to hear it repeatedly, that we cannot let our guard down. Y en español, el hecho de que no tengamos ninguna muerte no significa que vamos a dejar de redoblar todos los esfuerzos en cuanto a las órdenes y en cuanto a las intervenciones que hemos establecido con la ciudad. Queremos seguir de esta manera, y todavía nos faltan otras 2 o 3 semanas para que podamos ver el pico de esta pandemia en nuestra ciudad, pero no por eso tenemos que sentirnos halagados de que el hecho de que no hemos tenido ninguna muerte sintamos que ya estamos fuera del problema. No, el problema está aquí, y esto es algo demasiado serio que tenemos que tomar mucha responsabilidad cada uno de nosotros en seguir todas las reglas posibles para poder evitar que esto pase y que ojalá no tengamos ninguna muerte. No podemos dejar que cualquiera de nuestros seres queridos fallezca debido al COVID-19 si se pudo haber prevenido.
Gracias, doctor. This weekend, we surpassed triple-digit confirmed cases. Can you please talk to the plan in order to prevent that the community get to quadruple-digit cases? And at what point will we be at our peak?
As we mentioned a little bit ago, our peak should be coming within 2-3 weeks from now. So the non-pharmacological interventions that we have applied are proven to work, and we need to make sure that we're stricter about those. And if we need to, then definitely we will be able to do so, with the goal of saving lives. We need to make people understand that all these orders, all these regulations and directives are meant with only one goal, which is saving a life of a loved one. Y en español tenemos todavía en miras que en 2 a 3 semanas es cuando vamos a ver el pico de esta pandemia en nuestra ciudad, y que es responsabilidad de cada uno de los ciudadanos de nuestra ciudad seguir las órdenes y reglas que hemos impuesto para poder librar de mejor manera el efecto negativo de esta pandemia. Queremos recordarles que el objetivo principal de esto es el salvar vidas. El salvar la vida de cada uno de nuestros seres queridos es la razón principal por la que hemos instituido esto, y si necesitamos ponernos aún más estrictos en cuanto a estas órdenes, lo haremos, porque sabemos que nuestra responsabilidad es cuidar de cada uno de los ciudadanos en nuestra comunidad.
Gracias, doctor. The next question: at what point or when might the city consider implementing stricter measures to mandate that people stay at home in order to help further slow the spread?
We think that the order from last Wednesday is strict enough to preclude any or to allow us to suppress this virus. But if something else needs to change, we'll adapt accordingly. The county judge and I have agreed that we will do whatever we need to do to protect our community from this spread and suppress it as fast and as furiously as we can. And we recognize the pain this is costing or feeling that everyone is feeling, not only from having to stay at home, but from the economic issues. So the sooner we can get this under control, the sooner we can try to get back to normal as fast as possible. This is having a devastating impact on our economy and jobs and people. And we know that. And we're trying to get it under control as soon as as quickly as we can, listening to Dr. Ocarranza and other public health experts throughout the state and throughout the nation, and following CDC guidelines. That's what's driving every action that we're taking. But if there's more that we need to do, then we'll do it. But I'm hopeful, and I pray we don't have to do any more than we've done.
Thank you, Mayor. The next question. What trends are you seeing in the data? Specifically, Dr. O, you spoke to some of the age groups, but can you speak to the severity of the disease by age group or by the part of town or the way that they contracted the virus? They contracted the virus?
Well, what we're seeing is that over half of those cases are in young adults between 20s and 40s. So as far as the mild cases are in young adults, and this is what has been reported by CDC and other areas, we are seeing that the older population are the ones that end up in the hospital and might end up in the ICU, and we have seen that. That's the message that we want to tell the people, that the fact that we're seeing the mild cases in the young population means that they are the ones who are infecting the older ones, most vulnerable ones, and they're going to be the ones who suffer all the complications from this infection. Now that we're seeing the community spread, it is of special importance that people continue following what we have told them over and over, which is washing your hands very often, clean the surfaces, cough etiquette, don't touch your face, and most importantly, stay home and social distancing. That's going to be the intervention that is going to help us get through this virus. Y ahora en español, lo que hemos visto en nuestra ciudad en cuanto a las estadísticas de casos positivos es de que más de la mitad de los pacientes que salen positivos con el COVID-19 es en adultos jóvenes entre los 20 y 40 años de edad, lo cual vemos que esta es una enfermedad leve en ellos, pero aquellos pacientes que han estado hospitalizados y que acaban en terapia intensiva son los pacientes mayores y que tienen otros problemas médicos asociados. Entonces, de estas estadísticas podemos deducir y decirle a la comunidad de que estos pacientes jóvenes que tienen una enfermedad leve son los que están enfermando a aquellos más vulnerables, y por eso tenemos que tener muchísimo cuidado, y les vamos a seguir repitiendo todas las recomendaciones porque esto es lo que va a funcionar y estamos seguros que va a dar un efecto positivo, el cual todo el mundo tiene que observar: el lavarse las manos seguido, limpiar las superficies donde trabaja, donde está, el no tocarse la cara, el cubrirse la tos, el ahora ponerse máscara cuando vaya a estar fuera, y lo más importante es el distanciamiento social y estarse en la casa. Eso es todo lo que nos va a ayudar a poder disminuir esta ola de infección que vemos por el virus del COVID-19.
Thank you, Doctor. The next question. Are there any clusters of infection in the city? In other words, are we seeing multiple infections in specific work or businesses such as call centers or hospitals or within law enforcement, etc.? And I don't know if we have that information. The next question, are there any clusters or infections in the city? Meaning, are you seeing multiple infections in specific businesses or work facilities such as call centers or hospitals or law enforcement, etc.? And I'm not sure if we have that information.
I don't have information as far as clusters, but what we know is that if we have asymptomatic patients, they can be infecting other people when they're in close contact with other ones. And the places where most of the time we have a large gathering, so people are in grocery stores, especially on the weekends. When people take multiple household members, that's when they're going to be having multiple exposures to anybody at any given time that could be shedding the virus. As we see the virus spread through our community, we will see that anybody can be exposed and anybody can carry the virus. So we need to be careful. We do need to tell the community in general to be aware of that. Also, if somebody becomes sick in your household, please, everybody in the household needs to be isolated because anybody can be carrying the virus. So, again, please, we have been urging the community, we urge everybody to observe, stay at home. Y en español, no hemos visto que tengamos clusters o grupos de gentes infectadas del mismo lugar todavía, y no tengo esa información hasta el momento, pero lo que sí sabemos es de que mientras más circula el virus en nuestra comunidad, vamos a tener personas que van a estar expuestas al virus, ya sea por alguna persona que no tenga síntomas y que ya esté teniendo el virus en las secreciones, o por aquellos que salen teniendo síntomas y que exponen a otras gentes, sobre todo en lugares públicos donde hemos visto grandes aglomeraciones de gente, como son los supermercados en los fines de semana, en donde familias enteras van a esos lugares y exponen a todos los miembros de su familia, a cualquier persona que ande ya desechando el virus. De esta manera pedimos a todos que observen el distanciamiento social, que se queden en la casa y que si alguien de su familia empieza a tener síntomas o está enfermo, todos los de la familia necesitan observar el aislamiento para poder evitar el contagiar a otros cercanos a nosotros o a otros en los que estemos en contacto cuando salimos de la casa.
Gracias, doctor. The next question. The city of El Paso has asked the public to self-quarantine for 14 days if they travel 100 miles outside of El Paso. And the CDC recommends that if you travel internationally, you should self-quarantine for 14 days as well. The city mentioned that Ciudad Juarez is not as strict as El Paso. Should El Paso go into Juarez and come back and self-quarantine in order to follow the CDC guidelines?
We have a very unique situation because we are tri-state binational area. We have family members that go back and forth, and we're considered one community. What the CDC tries to tell the population in general, that if you take international trips, non-essential trips to another country, then you need to self-quarantine. And that is the meaning of the 100 miles going outside of the city. If we have somebody that goes out away from the community, then definitely they need to be self-quarantined. We cannot afford to bring more people that is infected just going out and about in the community, especially in essential travel when there's a large amount of people still going to do groceries, going to do other essential activities. It is imperative that the people understand that. And yes, even if Juarez has few regulations than us, we can communicate those kind of rules and orders that we have in El Paso, and people can observe them even in Ciudad Juarez or Las Cruces. It's never a bad thing to do more. The more we do, the better we will be. Y en español, el CDC recomienda que personas que viajan a otros países se hagan cuarentena por 14 días. Y la pregunta era de por qué no recomendamos a la gente que va a Ciudad Juárez, como es otro país, que hagan cuarentena sus 14 días. Lo que recomendamos es de que gentes que van más allá de 100 millas, que es por fuera de nuestra comunidad, lo hagan y que se pongan en cuarentena por sus 14 días. Nuestra comunidad es muy especial y somos una comunidad binacional y tenemos 3 estados en esta misma región, lo cual nos pone en una situación muy particular, pero a la vez podemos invitar a todos nuestros familiares, a todos nuestros seres queridos que observen las reglas, porque no está por demás el seguir las reglas más estrictas y es lo que nos va a dar más resultados positivos.
Gracias, doctor. The last 2 questions. If a test is conducted at a private doctor or a testing center and the test is positive, is that doctor or testing center required to report the positive test to the city, the county, and or the CDC?
When we have a positive test result done at a private lab and a private provider receives that positive result, he is required to report those positive results to the health department. It's part of the reportable condition list that we publish and that all our providers in our community are familiar with. Y en español, si alguno de los proveedores de salud recibe un resultado positivo por parte de un laboratorio privado, este proveedor de salud ya se les ha informado que tienen que reportar ese resultado al Departamento de Salud para poder darle seguimiento.
And the last question. Give me a moment. I'm going back through. Of the people who have tested positive, how many are in the hospital, how many in the ICU, and how many are recovering at home?
So far, we have 18 recovered cases. We have ten people in the ICU, and we have
I believe it.
27 hospitalized, 27 patients hospitalized.
Y la pregunta en español, de los que han salido positivos, ¿cuántos están en el hospital? ¿Cuántos están en terapia intensiva? ¿Y cuántos están en casa? O sea,
De los pacientes que se han recuperado, que ya se aliviaron, tenemos a 18 casos, 27 casos tenemos en el hospital y de esos 10 pacientes están en terapia intensiva en estos momentos.
Gracias, doctor. This concludes the press conference this afternoon.
Laura, let me add,
Yes.
let me add one thing that keeps coming up and I get contacted on.
Yes, sir.
It's been a revelation apparently to a lot of essential businesses that they need to take the temperature of their employees before they come to work. And if they are over 99 degrees, they don't need to be there. They need to be at home. We are taking at the city, we have implemented temperature checks at all essential government facilities, the police department, the fire department, public health, and the emergency operating center where you see Dr. Ocaranza and Jorge speaking from. So we're doing it. Everybody needs to do it. It's an inconvenience, but when you're dealing with life and death, it's a minor inconvenience. So I want to encourage and remind all of the essential businesses that are still operating that it is imperative you do at a minimum the temperature checks. Did you want to reinforce that, Dr. O?
Yes, sir. As the mayor said, checking temperature is something that is so simple, and it's a very easy way to determine whether somebody is going to start being sick or is already sick. So It is not an inconvenience, it is a must. If you are a responsible business owner, a responsible employer, please take care of your employees. Do that. We're all doing it. If we all take care of each other, we will be in better position. So, y en español, una de las cosas que estamos ordenando a todos aquellos negocios que son esenciales es de que le estén checando a todos sus empleados por lo menos la temperatura y los síntomas para que si alguno de ellos llega a trabajar enfermo, lo regresen a su casa para evitar el contagio de muchas más personas. Todos en el gobierno lo hacemos, en el alcalde, en todo el City Hall, la policía, los bomberos, en estos centros de gobierno nos estamos checando y monitoreando continuamente para protegernos unos a otros y eso queremos que sigan haciendo todos los negocios esenciales que permanecen en operaciones.
Gracias, doctor. Thank you to everybody who joined us here at the press conference. This concludes this evening's press conference, and we'll have a safe evening.